I'm sure these days most people would realize or understand what fertility treatments like IVF is, because it's almost very quite common nowadays, because in your family you might know of someone who's having a bit of difficulty falling pregnant, not having babies, someone has gone through a fertility treatment like insemination or even IVF. So it's commonplace, and in Hollywood a lot of movies are revolving around the celebrities and celebrities going for treatments like fertility, and movies made of about this, and they sometimes glamorize or make it give the wrong messages sometimes. But what is important is we realize, and this is throughout the whole world, every country, the problem of couples not having babies is getting bigger and bigger. Thankfully, we have advances that help to make the human being reproduce, and we are pretty efficient at that. For example, let me say how efficient we are. In a natural conception, if a couple were to try a month, the chance of nature making a pregnancy is at best maybe 22%, maybe 25% if they're much younger. But in IVF, it doubles it. For age by age, it can double it. But of course, when a woman gets much older, and this is a really important fact, it becomes harder and harder both for natural conceptions to occur and also for fertility treatments to work to produce a pregnancy. The reason being, the egg in a woman and the number of eggs and the quality of the eggs are the same as it was when she was first born. And over years, she loses eggs, and every woman loses eggs in every month. That's okay, because you still have enough by the time you're 35 and all. But by the time you get 35, the drop in the egg quality and number is quite what we call exponential. It really drops quite fast. So that's why we always become more proactive. If a couple comes and she's already 35, I would tend not to waste time with other less efficient treatments, and quickly tell her, we better be more proactive. Also, the message we want to put across to everyone is, if you've been trying for a year, even if your periods are not totally regular, even if you try just once or twice a month, most couples, at least 80% of couples, should have gotten pregnant. And if you don't get pregnant, I know it's very difficult to talk about something as sensitive as that. You must and please go and seek some advice from a doctor, and preferably a fertility gynecologist, unless you have a gynecologist who's aware of things like this, the fertility issues, and then quickly get yourself investigated. Sometimes it may be just a timing issue, very simple. Sometimes it may be a critical problem like very low sperm counts. 40% of the time, throughout the world, the sperm counts have all been coming down because of pollution, we believe. Of course, yes, lifestyle, smoking, heavy alcoholism, drug abuse, and all that does cause problems, but overall, sperm counts are coming down. Overall, women are getting pregnant or wanting to get pregnant or thinking about having babies when they're older. Now, I know it's fashionable to say, okay, women, blame the woman. She is having babies later, but I think that's not fair, because we are educating our women. They have such an important role to play in our society. We expect so much out of them. There's only 24 hours in a day. How is a woman going to do that, plus childbearing? I think a man must step in and play the role of at least child rearing more together with his wife, so that if she were to have a family earlier, always, even though we got good treatments, we always encourage women to start family earlier, because even IVF, as I mentioned earlier, if you start too late, it's not going to work as well. In fact, the funny thing is, we, the fertility people who have invented good ways to have babies for women who can't, are the victims of our own success. Because we're fairly successful, people get the wrong impression. Oh yeah, I can wait. It doesn't matter. I can be 40, I can freeze my eggs at 40, and I still can have a baby. That is so wrong. So wrong, because the egg quality is poor. You don't have much eggs, and IVF can only do so much. That is one thing we haven't been able to reverse the effects of aging on eggs. So always remember, the very critical message I want to put across is still have your babies early. If you find you're not having your babies early enough, you tried, don't waste time. Within 1 year, if you are younger than, say, in your 30s, late 20s, within 1 year, you try, give yourself a chance. But if you are 34, 35, 36, if by 6 months you're not getting pregnant, go and see the doctor. Don't waste time. Most important. Now, when you see the doctor would probably interview and say, do you have previous operations? You know, sometimes the operations like appendix can scar the womb, can scar the tubes, block the tubes, or if you've got previous infection, STDs, or if because and STDs are on the rise because we are using contraceptives and more than one partner and so on and so forth, and throughout the world that's a big problem too. Or sometimes you have, as a woman grows older, she has got certain gynecological problems like something called fibroids, which are growths in the uterus. By the way, it doesn't mean that just because you have a fibroid you're going to have fertility problems. Many women who are very fertile have fibroids too, but if the fibroids are big, causing blockage, yes, it can be a reason. There's a condition called endometriosis. Endometriosis is the menstrual blood that flows backward. Now, a lot of women, the menstrual blood flows backwards, but in some women it sticks into the pelvis and it forms like a rust and causes scarring. They may produce toxic substances. We really don't know how endometriosis does this. We haven't found a way to clear endometriosis forever, but we can control it. And if we diagnose it early, many a time we do something called scope surgery, laparoscopy, put a little telescope inside, look and clear it out. Because on ultrasound scan you can't see it, unless of course there's a cyst. It's called a chocolate cyst, chocolate material, blood, and then we open and cleanse it. And if we find small ones, we usually don't take it out, because the operation to take it out can damage the ovary. So doctors who are fertility doctors are very careful. It doesn't mean that just because a woman has a fibroid, we put her through surgery. We have to really carefully select. You've got to go to a doctor who is very careful and cautious and not just do surgery before thinking very carefully how to make you become a father and a mother. It doesn't mean you have to go through surgery, but sometimes we do surgery. Other causes can be like pregnancy that is getting stuck in the tube, ectopic pregnancy due to blockage, and then it damages the tube. Or some women are born with certain abnormalities. They tend to cause miscarriages more than fertility problems. But we, the fertility doctors, we also see couples who have a lot of miscarriages, because could be immune, could be thyroid problems, could be scar in the womb or a wall in the womb. So these are the whole thing. The whole thing is examined and analyzed when a couple first comes to see the fertility doctor. Usually a simple scan is done. In my practice, in my clinic, what I do is I usually suggest to them come at day 2 or day 3 of the menstrual cycle. So if today, this morning, you have your menses, today is day 1, tomorrow is day 2 or day 3, I do a scan, because at that time is the best time to look at the ovaries to find out how many little standby, what we call egg bags, follicles. That gives you an idea of how strong the ovary is, what is the reserve of eggs a woman has. At that time also, we do a whole array of hormone tests. They're very important hormone tests to check whether there's thyroid, to find out there's a test called AMH, anti-Mullerian hormone. It's a very useful test to tell us what's the reserve. Because you see, I can see a girl who's 32 years old and she's young, and you expect, she should have a large amount of eggs, but suddenly we find that her egg count hormone, AMH, is rather low, and no one knew about it. No one knows that you have low egg counts. A man can be walking down the street, bodybuilder, very strong, and he might have no sperms or very little sperms. No one knows, you see, unless you check it out. So for the husband, of course, we do a simple sperm test and some blood tests. Also very important, because we are helping couples to have a healthy baby, we also have to make sure that the mother and father, especially the mother, hasn't been infected by any infections that can be transmitted, or also we want to protect her from future infections. So we check and see whether she's got vaccination for hepatitis A and B. We also check hepatitis C. We check the VD levels, we check HIV, we check rubella, we also check chickenpox. So in my clinic, we do one blood test, clear the whole thing. No point doing a little bit and then think about another one a little bit. So at least when many of our couples come from overseas, we want to make it compact. In one assessment, everything is done. So always coming at day 2, day 3 is useful. And sometimes we also do a small procedure called hysteroscopy to look into the womb, because that's where we're going to put the embryo when we do IVF. I'll talk to you about IVF later. And that's a clinic procedure. We just do it in a clinic to look inside the chamber, because that's the room where the baby is going to grow. So if there's any problems, we should know about it, like polyps, scar, fibroids. Because if we get nice embryos, we do this whole treatment and then we put it in a chamber, the room that is not suitable, and we can't see this always in the scan, and then she miscarries, that's going to be bad. So we want to do things before hand and to prepare the mother to be for a good outcome in pregnancy when we put the embryo in. So in that one visit, maybe it takes, most of my foreign patients, they spend about say 3 to 5 days. All the tests are done. And in Singapore, IVF is very regulated for the safety of both the doctor and the patient. We always can only do it on married couples, so we would like you to bring your marriage certificate translated in English, and we register you at the IVF center. And after the initial evaluation, and if there are certain things that you need vaccination, we do the vaccination first, so that in a month or 2 we can start the program. Nowadays, we are making our IVF very compact. Last time, it takes us about 2 weeks to do the IVF. Now it's 2 weeks and then another 2 weeks to actually do the stimulation. Now the IVF has become compact. On the second day of the menses, the injections are given maybe about 10-12 days, and we are ready to egg collection is a minor procedure. She goes into the hospital under a light anesthesia, painless. Through the vagina, we use a little needle to poke into the follicles. Follicles are the egg bags, which we measure every few days in the clinic by ultrasound. Simple measurements, very easy to do. And we find out how many eggs are ripe, how many follicles are ready to pick. And we suck out all the eggs, some mature, some too mature, but we hope to get a good number of mature eggs. We give it to the lab. On that day, the husband would have produced a sperm. Sometimes the husband is overseas. He cannot make 2 trips because of work. So we freeze the sperms from the previous time. Whether it's frozen or fresh, no difference. So many of our couples have good outcome with frozen ones, because it's very hard to go to and fro. So we make it very easy for our couples to have treatments in our center. And we take the sperm. The embryologist will do this in the lab. We do ICSI, sperm injection, and try and see whether over 24 hours it fertilizes. Okay, that means fertilization means fusion of egg nucleus and from the mother and the sperm nucleus from the father to make an early zygote or baby. It's called a zygote. Then we watch it every 24 hours. Suppose we have 10 eggs, we inject 9, maybe 8 fertilizers. So every day a little bit less and less it goes on. That's the natural thing, selection of the fittest. Then the first day, that's fertilization. Second day, we see whether the cells are breaking into 2 and 4 cells. The third day, about 8 to 16 cells. That's the usual growth. In our center, when I do my IVF, we tend to do blastocyst, because blastocyst means day 5, because we are trying to select out the strongest embryo. No point putting embryo and then freezing and they end up having to come back again. We get high pregnancy rates, and we try and reduce multiple pregnancy. We all know the danger of multiple pregnancy. Triplets, quadruplets is really dangerous. They come out too soon, they're premature, they get brain damage, they get very sick. It's very costly. So maximum we put in 2 embryos. Unless a girl is more than 37, failed 2 cycles, then maybe we put 3. But even then, because our success rates are pretty good, we sometimes put in 2 by blastocyst, and we improve the womb lining by giving hormones to thicken the matka womb lining to make it nourishing for the baby to grow. So as I said earlier, we grow it to day 3, day 4, day 5. So every time you get lesser and lesser. Then if you say we got 5 embryos, we will freeze 3, keep it, stop and put back 2. And we give hormones to nourish the pregnancy. And after 2 weeks, we hope the pregnancy test is positive. And another 2 weeks after that, we do a scan and see how many babies are growing. Usually 1, sometimes 2. Because our success rates are pretty good, in the region of, for a woman who's 30 years old, we can get a pregnancy rate of about at least 50 to 60% in young women. The take-home baby rate of at least 35 to 40%. And it's high, and that is why we are putting in only 1 embryo, because we used to get high twin rates, 25%, 20%. Nowadays we put in 1 embryo. If she's already 35, then the pregnancy rate drops at least by about 10%, quite a big drop. At age 40, it's very low, maybe 10, 11%. So that is why we always encourage, and we don't waste time. Suppose a couple comes to me at 38 or 39. They have not gotten pregnant for, say, 3 years. They tried all kinds of things, but the 3 years they didn't get pregnant. No way we're going to waste any more time. IVF, straight away. Because the 2 factors that are very strong factors as to whether or not a pregnancy will occur is, number 1, how long they haven't been pregnant, and also the mother's age. So in a patient who is first time, just gotten married, very regular cycle, 38 years old, even then I would be very proactive. Maybe I'll do insemination and stimulation first, and if they don't get pregnant in 2 or 3 cycles, don't waste time, go to IVF. The big problem now is we ask ourselves the question, why hasn't the couple, in many countries, why wasn't the couple given access to IVF? There are 3 big studies, 1 British, 1 American, and 1 Australian and New Zealand, to show that if you do injection and insemination between 5 to 7 times, the cost of all of that and the pregnancy rate over all of that is even more than 1 good cycle of IVF. Do 1 good cycle of IVF for that couple, the chance of getting pregnant is a lot more, at least 50% more. 50% as opposed to maybe 30%. So it doesn't make sense to go on and on and on in the treatment. And so, and couples must realize that it doesn't mean that IVF is the last resort. No. Sometimes in a couple, like for example, the tubes are blocked, or the sperm counts are only 1 million, or they have tried many times natural conception and she's already 38. Don't waste time. Nature, we as human beings, natural conception, we as human beings are very inefficient at getting pregnant. We are not very efficient. You see, only 20-25%. You see, so because of that, and thankfully, God has given the intellect in us, an intellect to invent ways to make our fertility higher. We can now achieve a good pregnancy rate. The big problem now, we all are 2 problems. One is a medical problem. The reason why our pregnancy rates are not higher, like 80%, is because when we put back the embryo, we can't tell, although it looks very pretty, very nice embryo, we can't tell whether there is a chromosome abnormality in the embryo, even though we go to blastocyst. There is a technology where we can take 1 cell out and screen for all the chromosomes and see whether there's an abnormality, so that we put back only normal embryos, and that has increased the pregnancy rates. Also, there's new advancements where we're looking at the metabolism of the embryo. Is there enough lactic, how much lactic acid is producing, what are the enzymes it's taking, what are the new amino acids it's taking, and we are studying, and we have a microchip. When we put that, it's called a microarray technology, you can tell how healthy an embryo is. We have studied these effects to see eventually we follow through. This is the embryo that became a live birth. Why? We go back. But this is still in the state of evolution. It's very, very expensive. It hasn't come into routine use yet. Blastocyst is a very good thing, but we are also hoping that because of genetics we have to select the best embryo. Also, we want to put the embryo in a good environment. So sometimes we're preparing the womb. Sometimes when a woman has too many eggs, she overstimulates. The hormones are too high, so it affects the womb and is not ready to put back. So we freeze everything. And now our freezing technology is much better. So the chance of losing an embryo after we unfreeze or thaw it is much less. There's a new freezing technique called vitrification. And by doing that, we can really store the embryos quite well, quite healthy, and when we take it out, we don't lose many embryos, and we can even freeze eggs that way. So with all this coming together, we are trying to improve what is known as implantation rates. That means if we put back the embryo, how can it take root? That's a big gap. We can make good eggs, we can get eggs, we can take the sperms, we can make them fertilize, we can grow the embryo, we select the good embryos. Implantation. So now we are also studying the womb environment. What are the chemicals in the womb environment? And these are advances going on so that we get a better pregnancy rate. And by reducing the number of embryos, that means if it is a normal one, we know the miscarriage rate is lesser, we put one. We don't want to give a couple, even twins can be a problem. Our promise must be a single healthy baby born at the right time. Just like nature, one baby. Nature makes only one baby born at the right time. So we should do that and not make twins and things, even triplets, of course not. So that is our emphasis. That's our aim towards giving couples a good way. Now the question is always put to me, but doctor, many couples go through all these programs and they are very stressed out. Yes, stress is one of the things that causes a lot of dropout. That means people try once and then they find it so much hassle, they leave it. And about 50% of people can do that. And the problem is actually some couples who don't get pregnant the first time, yes, by doing it more than once, your success rate actually improves, because by doing IVF is not only a treatment, but it also diagnostic. That means we find out, okay, because you went through IVF, we discovered a few more problems and we can correct it, and the next time around we improve it and they get pregnant, you see. So we must make it easier for them. So how have we done it? We have made the injections very painless. Now a woman has a pen. She just clicks the injection and then pushes the tummy and then gives it, and she goes to work. She doesn't have to come to the clinic. Only a few days to just come and do a quick scan and then a blood test, and she goes back. Now one of the companies has made a long-acting medicine. On the second day she has an injection, and she doesn't have to have 7 days of injection. 7 days later, 1 week later, she comes back, and then we give a little bit of top up and she's ready. So it's making it so much easier, so patient friendly. And so that is why we are trying our best to make it less problematic for couples to go through. So now IVF has become fairly reasonably easy to go through, not as daunting an experience as before. Success rates are better, but then there's always some dangers. The biggest danger in IVF is overstimulation, OHSS. When a girl has an injection, sometimes in certain women who have a condition called polycystic ovaries, or in women who are very young, they overproduce the follicles and they get all bloated up. The ovary becomes like a bunch of grapes, and it sucks proteins from the bloodstream, makes the blood thick and dry, and you can get thrombosis, clotting, strokes and things like that in the very severe cases. Of course, doctors never allow it to become that point. So we try and give fluids, we try and use smaller doses, and sometimes we make the eggs and we freeze all the embryo. Don't put back, because if you put back and she becomes pregnant, it's like a train. The momentum is there. If you're pregnant, it boosts the momentum, and you get worse, you see. So we try and do segment by segment. That's why when our foreign patients come in, sometimes I tell them, look, don't expect that when I get the embryos I'm going to put back, because sometimes in people who don't respond, we longer, and the egg growth and the womb lining not being ready is out of phase, and if you put it there, it won't become a pregnancy. So it's better to freeze everything, rest the system like a race car is overheated, switch off the engine, rest, and come back maybe as 1 or 2 months later when you're less stressed, and give a good environment for the embryo to grow, and then take the embryo and put it inside, and in a natural cycle like nature intended, and then pregnancy rates are so much higher. Although yes, another visit, but you are having a successful outcome. No point doing everything in a compact, stressing your system, and you don't get a successful outcome. So those are the things we strategize. There's a very new technique that we are using now to make the chance of getting overstimulation zero. It's a major advance. This technique actually was known to us in the 1990s, but no one really paid attention to it. It is called agonist trigger. So we can grow the eggs, and we know there's a lot, but the type of injection we give to ripen the egg used to be very long acting. It's like this. Suppose we ripening, the hormone stays there too long, and it runs the system, and that's why she gets overstimulated. Now we have something called agonist trigger. The hormone goes up, down, shut down, but you can't put the embryo because it shuts down the system. So but she doesn't overstimulate, it just shuts down the system. So we freeze. It's called a freeze all strategy. I mean, stimulate, catch, stockpile, freeze all, come back another day, relaxed, do the embryo transfer. In this way, we actually have prevented major problems. One of the most dangerous things in IVF, everyone talks about it, is overstimulation, and it's now become almost zero. So overall, now when you talk about IVF, it's no longer like such a major thing, and because we know that this makes having babies so much more efficient, the other techniques are so far in efficiency that it's too far apart. If we try, we shouldn't try 10-20 cycles. 2 or 3 cycles, not getting pregnant, don't waste time. My message I want to put across is, have babies early when you're young, work together. Husband and the husbands must take responsibility. I think it's a man's problem as much as it is the woman's issue. It's no longer good to say it's women always delaying pregnancy. Yes, age is a major factor. Women must realize. Although nowadays, because we can freeze the eggs, many women are thinking of freezing their eggs. Good idea. Social freezing is good idea. I think it doesn't mean that she is irresponsible. I think not all of us are lucky to meet the man. She may not meet the man of her life and want to marry the man of her life, or maybe she went through a relationship, it broke down, or a divorce, and then for a man he can just go on to the next person, a younger woman. But what about for a woman? Now we have an opportunity to go through a process. Yes, it's a little bit involved to freeze her eggs, but that shouldn't be the way, because for one egg to become a pregnancy, there's only 2 to 5% chance, and you have to collect many times, 20-30 eggs before you can have that reserve for later use. So the best thing to do is have your babies early. If you try to have a baby, you're not getting pregnant within 6 months to 12 months, please see the doctor early, so that you can become and realize your dream of becoming a mom and dad. So IVF thankfully has become a lot easier. We try and help our couples in our clinic, and I hope that we can continue to help our couples in our clinic.